Hello, welcome to the live broadcasting of Erufu, the online community medical support network. I'm Shireen. Chronic lower back pain is often found in the elderly, while acute pain can be caused by fall or other mishap. Lower back pain is becoming more common among younger people who are desk-bound all day or those who are doing manual labor work. In general, lower back pain, which usually does not involve serious conditions, is caused by poor posture and exceeding the endurance limits of the back or the abdominal muscles. Then next, you will be wondering, how can we take care of our lower back? Tonight, we have invited senior physiotherapist, Mr. Ben Loo, the healthcare partner of Erufu Care, to share with you 5 tips of taking care of your lower back. Welcome, Mr. Ben.
Hi.
Hi,
Hello,
Mr.
thanks.
Ben.
Hey, thank you.
Before Mr. Ben have a start of his sharing, I'd like to just give a brief instructions on Mr. Ben. Mr. Ben graduated from the National University of Malaya in Bachelor of Science in Physiotherapy in 2008. He is a certified senior physiotherapist, and Mr. Ben is very keen interest in manual therapy in musculoskeletal physiotherapy, sports injury, and neurological rehab, using his own approach. That's the Ben's approach. So as Mr. Ben enjoyed running, in addition, he's actually founded Ben's Running Clinic to help runners from physiotherapy point of view to improve the runners' running performance. Yeah. Mr. Ben, you can start your sharing today.
Okay, thanks, Shireen. Okay, cool. So can be seen, right? My slide?
Yep.
All right, thanks. Okay, so all our lovely audience, thank you for the night, 8:30 p.m., 9th of September. Okay, so today I'm going to share a little bit about low back pain. So perhaps you may not know who am I. So my name is Ben. So I come from a private physio center called Ben Physio. All right. So as our team, or as our name BEN stands for biomechanic. Okay, which elaborate or describe how we assess your problem. All right, and then E, effectiveness. Okay, which also to elaborate or describe how the treatment works. Okay, the effectiveness of the treatment. And N is a very more special key, which tells you non-conventional. So a lot of people will always ask me or tell me, right, hey, I have been at this physio A, physio B, physio C, physio D, or even physio hospital, the grand physio. Hey, so I have been so why I need to come and see you? So therefore, from this end, the words tell that we are a non-conventional physio. All right, how non-conventional we are, you only try us out there, only you know. All right, so basically, just for everyone's information, yesterday, 8th of September, all right, actually it's a World Physiotherapy Day. All right, so it's a World Physiotherapy Day, so it's an event, it's an international event to celebrate the effort, the profession of physiotherapy. So why it was so important? Now let me share with everyone a little bit, right? So a lot of people nowadays thought that, oh, I see physio because I got stroke. Oh, I see physio because I got Parkinson. Or I see physio because I got a fracture. But actually, the information that you have is already outdated. All right, this year, what is impacting or what is affecting the whole global, the entire globally? Okay, it's a COVID 2020. COVID 2019. All right, this COVID 2019, besides the frontliners, all right, which is our policemen, our soldiers, our doctors, and do you know, right, when you stay in hospital, when you are admitted into hospital, the one profession, the health profession that you see most and you wish to see them most is physiotherapist. All right, so actually physiotherapy is the key, all right, is the key person for you to recover from your COVID-19. All right, this is the latest physiotherapy role in COVID-19. So I just give a small share, right? So over COVID-19 recovery, like, or rehabilitation from physio point of view, we will need to put our patients in a facing down position, okay, to allow them to have better ventilation for the lungs. Okay, this is a key treatment, okay, for COVID-19 patients. All right, anyway, so this is physiotherapy. All right, so before I proceed with talking about low back pain, right, Sorry. So I would want to have a little bit of a clarification, all right, and sharing, all right, regarding what is physiotherapy and what is chiropractor. This is what a lot of people will ask us as well. Now I just put a very simple description here, or comparison here. Right now, basically, if you see a physiotherapy or chiropractor, yes, both of us are not doctor. All right, I repeat, both of us are not doctor. All right. So even though you see a chiropractor, they claim themselves Doctor blah, blah, Dr. Ken, okay, Dr. Ben, Dr. Bean, all right, but honestly, they are not a doctor. All right. So physiotherapy is not a doctor, but we are medically recognized. All right, chiropractor is not a doctor and they are not medically recognized. All right. So second point, where can you see us? All right, now physiotherapy, you can see us everywhere in hospitals. Okay, government hospital, private hospital, okay, government physio center, private physio center like Ben Physio. All right, now chiropractor, you can only see them in a private chiro center. That's all. You won't see them in hospital. Why? Because they are not medically recognized. All right. So what is the approach, or what is the biggest difference between these two professions? Now, both also treats pain. All right, both also treat the shoulder pain, okay, neck pain, migraine. So now both of us have a very great difference in our approach. Now, in a way, physios believes in soft tissues. Okay, physio believes in soft tissues. For example, your muscles, your ligaments, your tendons. All right, that causing wear and tear and pain. Okay, but chiropractor believes in spines, joints that causing wear and tear and pain. All right, this is the biggest difference between all two of us. So that means what? If you are having for example, if you're having a low back pain today, all right, physio will tell you your low back pain come from your soft tissues, the disc, okay, your spurs, or your muscle tissues, ligaments, all right. But chiro will tell you will be your joints, okay, in between facet joints in between your spine. Now, this is the biggest difference in our approach. So therefore, when we have a very different approach, our treatment method also will be a little bit different. So physios will focus on a soft tissue manipulation, something like a massage technique, joint mobilization. After we loosen your muscles, we will do a little bit of on the joint to loosen the joint. And then we also will teach you some exercise to build your muscles, to stretch your muscles, as well as some electrotherapy to facilitate our treatment. Now, and chiropractor, mainly their treatment module will be manipulation. Manipulation is something like I'm using a thrust effort, all right, to open up or to loosen up the joints. All right, so these are a simple sharing. Okay, what's the difference between physio and a chiro? Okay, so let's get to our topic today, low back pain. So very quick one, in Malaysia, our low back pain is about 12%. Okay, but this is in 2012. Okay, but actually it's a lot more because there are a lot more not reported. Okay, so most important is we know everyone will have low back pain. That's all. All right, that is a summary. Okay, now today my role here is just to share a little bit about low back pain. There are a lot of types of low back pain, okay, and we call it unspecific root cause low back pain. But today I'm just sharing a typical, okay, root cause of low back pain. Now, normally if someone comes in with low back pain, right, come and see us, right? Now, everyone look at the, if you all can see my arrow, huh? So everyone will look at the number one there, okay? The one they label number one, lower back muscles. Okay, everyone look in your low back muscles, all right, including your doctors, okay, your physio. But honestly, today what I'm trying to tell you is your low back pain or anything at the low back muscles is not only your primary problem. All right, your primary problem is actually happens at the diagonally crossed lower, which is we call it hip flexors muscles. All right, this should be your root cause that leads to your low back. All right, that's number two. And number three, you look up is the weak core muscles. All right, we call it all your core muscles, which a lot of people are telling you, oh, you have no core, you have no core. All right, this is what we mean, the low core muscle, weak core muscles. And number four, your weak buttock muscles. All right, so basically, if I want to treat your low back, I will look into 1, 2, 3, and 4. All right, I repeat, if I want to treat your low back, okay, forever, I will need to look into your 1, 2, 3, and 4. I cannot just look into your number 1. This is never enough. All right, if I look into your number 1 problem only, you will keep on coming back and see us. All right, which I will be happy because you are my patients. All right, but this is not the way. All right, so now, among all these 1, 2, 3, 4, right? Now, the most typical posture that you can see or the most typical posture that leads to low back pain, only one type. We call it arched low back. Okay, arched low back. As everyone know, the low back always come with a little curve. All right, now when you excessive little curve, okay, we call it arched low back. This is what you're going to have okay, in your body. Okay, so this is a low root cause of the low back pain, of any low back pain, or what I call it 99% of the low back pain. Okay, I cannot include 100%. Okay, 99% of the low back pain. All right, and so I'm going to talk about two types of low back pain only today. Okay, because these two types is sufficient to frighten our audience today. Okay, or sufficient to frighten our audience tonight. All right, now the type number one, we call it multifidus cramp. Actually, it's a back muscle cramp. Now, if our audience have ever suffered cramp at your legs, okay, then you can imagine how pain you are. All right, now when your low back muscles or back muscles in cramp mode, I tell you, it's the same thing. All right, but it's just that the presentations will be slightly different. All right, now another type of low back pain, we call it sacrum swelling. There will be some sacrum swelling on your tailbone area. All right, so now number one, low multifidus. Okay, multifidus, we just in short we call it multi. Okay, we always call it multi-cramp. Multi-cramp. So what is multi? So basically multi is a very, very tiny muscles deep inside your spine. All right, as a red bracket. Okay, the tiny muscles deep inside your spine. All right, so what do? They try to support you. All right, this is a very important muscle. We call it multi, very important muscle, VIP, in your spine. All right, when this little muscle cramp up, okay, your whole day gone. Okay, your whole day gone. All right, so why? Number one, pain, no? Don't need to say, that's why we are here today. All right, number two, you feel cramp, or you feel the whole back is seized up. Okay, or some people say, oh, I can't stand straight now. I can't walk straight. Okay, walk straight means I walk with the posture straightened. I can't even get out from my bed. I can't even turn. The moment I wake up in the morning, I can't even turn. All right, so I have pain when I sneeze. I have pain when I cough. Okay, I have pain even when I laugh. All right, I can't even twist and toast on my bed. All right, I have to very slow to get up from my chair. Okay, so when the car drives over some bump, okay, and I feel the pain. I don't even dare to drive through the bump. All right, I can't even put my underwear in standing, or I can't even put my pants in standing. All right, now these are the typical daily function deficiency, okay, symptoms, okay, when you suffer multi-cramp. All right, or some people even have these symptoms. They feel like, oh, when I stand up, my whole body sengit. Okay, my whole body sengit. Or it may come with some sciatica pain. So all these are typical symptoms or presentation of multi-cramp. All right, okay, multi is our VIP muscle, very important muscle in the spine. All right, and a second low back pain that I want to introduce today, we call it sacral swelling. Okay, now sacral swelling, that means what? There is some swelling along your this what called tailbone. Okay, so therefore definitely there will be some pain at the tailbone. So actually, if you can distinguish between multi-cramp and sacral, right now they are a little bit different. The location, okay, multi will be slightly along the spine, sacrum will be along the tailbone. All right, and because it's swelling, so normally the pain is in the morning. It strikes you in the morning, and then you feel warm when you touch it. You feel tender when you touch it. Now, imagine, okay, your tailbone already got swell. All right, there's a lot of swell, warm, tender. Now you can't sleep on your back now. You can't sleep face up. All right, this is the typical sacrum swelling. All right, now you also feel like you can't sit long or stand long. All right, but again, our dear audience, you may not need to understand these two. How to distinguish these two? Not important. Well, the most important is if you have these two kind of symptoms, approach us. All right, this is where you need a professional assessment to find out what's wrong with you. All right, now why we pointed out these two? Because if you have sacrum swelling and if you have a multi-cramp, your medications are totally different. All right, normally if someone will come with sacrum swelling, we will advise them to get anti-inflammatory, all right, to bring down the swelling because there is inflammation. Right, but if it comes with multi-cramp, all right, anti-inflammatory won't work for you. All right, you need something called muscle relaxant. Okay, so this is the difference. So therefore, if you have all these symptoms, do not try to diagnose yourself. All right, do come and see us so that your physio or any physios near you, so that we can tell you what's wrong with you. This is more important. When you know what's wrong, then you know how to treat. Okay, so what causes swelling at the sacrum? So again, as I mentioned just now, arch back. Today, what we're going to do, what we're going to see only one thing: arch low back. Okay, over arch low back, over straighten low back. All right, because all this will cause wear and tear at the tailbone area. Okay, and therefore swelling will happen. Okay, so what is the causes of low back pain, or what is the causes to or to contribute to overarch low back? Okay, now pregnant. So when we are pregnant 3 months, 6 months, 9 months, okay, as your tummy is getting bigger and bigger, so our low back will getting more arch, more overstated. All right, this is a typical change, especially in ladies, okay, pregnant mummies. Now, how about the photos on your right? Now, this is a typical change for a guy, okay, when it comes to the age of 30, 40, 50 and above. All right, so reason, not because there's a baby, but because there's getting more and more fat accumulated. All right, so okay, and again, this is another symptom, and this is another cause to cause overarch low back. All right, so now normally guys, when guys comes in with this kind of belly tummy, I always tell them, look, you have to find a way to take it out. Okay, take the baby out, the pseudo baby out. All right, otherwise your back will always over straighten. Okay, of course, mommy with babies, you wait wait for for the baby to come out. All right, but of course, while waiting, you still can come and see us. All right, so but for the guy, you have to do something to take out the belly. All right, now what else? And what else? The causes of overextended or overarched low back. Now, when you do your exercise wrongly, now if you look at these three ladies, right, they are very good. They are doing the exercise, okay? But look at how they do the exercise. They overarch their low back, right? Okay, so like this photo in the center, okay? I think most of us are often seen this kind of posture, all right, is in certain practice. All right, but again, this is what I always tell my clients. Look, if you're practicing this practice, be aware. All right, do not overarch your low back. All right, so or you're doing plank on the floor. Okay, you tell me, oh Ben, I'm doing plank. I have a very strong core. Okay, but how come my back is painful? So I will tell you, most likely you are engaging the wrong. Instead of engaging your core, you're engaging your low back. All right, so I'm a runner. Same thing. Okay, so same thing. What else the causes that cause over straightened low back? All right, the picture on the left, okay, the picture on the right, the gym carrier. All right, so the picture at the bottom, okay, I do bridging at home. Okay, I do bridging to strengthen my glutes. Now, when you over bridge yourself, okay, you will also over straighten your spine. All right, and on the right bottom, that's the typical low back pain cause. All right, which you carry things from the wrong way. Okay. Okay, so listen, if on the floor there is a piece of what I call it 100 ringgit, okay, the notes, bank notes, do not try to lift it up using this posture. All right, you will need to pay more than that. Okay, so always follow the proper way, even though it's just a bank note. Okay, so trust me. Okay, don't try it at home. Okay, so what else can cause an arch low back? All right, so high heels. This is ladies again. High heels. All right, because when you are on high heels, heels change you. All right, heels change your posture. The elevated heels change your posture. All right, so does it mean that so does it mean that I cannot wear high heels anymore if I got back pain? So my answer is no, you still can wear high heels. All right, but question is, do you know, okay, how to protect your posture, how to protect your back after you wear high heels? This is what you need to know from us. All right, so of course, after this, we'll give you some tips, okay, for the low back pain. All right, so the tips will also help you a little bit on this. Okay, we will talk a little bit about high heels after this. Okay. Okay, so you may say, Ben, all the photos that you give all are the Google one. Can you give me something real one? Okay, now I'll show you something real one. Okay, so I have a young lady on my left. Okay, same thing, overarch posture. All right, and she came for migraine. All right, so I have a middle-aged lady, also overarch posture. Okay, low back pain and hunch. And if you tell me, hey, so in that case, Ben, that means a lot of ladies will have it, right? So let me tell you, guys also will have the same thing. All right, and look at this guy, young man, 20 plus, okay, and look at his body, overarch low back. All right. So what do you see? All these three photos. One thing, overarch low back. All right. So today, overarch low back will give you a lot of problems. Okay, trust me and believe me. All right, they will give you a lot of problems. All right. So therefore, we are here. Okay, Ben is here to how to educate you how to remove your overarch or over straighten. All right. So as we said, pregnant ladies. Okay. So you may say, oh, okay lah. After what 40 weeks of pregnancy, baby comes out, my back will return normal. All right. But I will tell you, your low back will never go back to normal arch anymore after your pregnancy. All right. And this explains why a lot of ladies have more ladies to have low back pain, okay, or knee pain compared to guys. All right. I mean, it makes sense because most of the ladies, they go through the pregnancy. Every pregnancy, your body change. Okay, pregnancy of 2, your body change a little bit more, double. Pregnancy of the 3rd one, it change even more. All right, if you have 10 babies, you change 10 times more than others, 10 times more than others. All right, so these are one of the cause of overarch back. Now, if we have audience of parents, all right, so if all have audience of parents, listen here. Now, whenever you ask your kids to sit straight in the table, all right, this is a wrong instruction you were trying to cultivate in them. All right, okay, I say again, if you are trying to ask your kids to sit straight, okay, in their table when they're doing their homework, this is a very wrong instruction that you are cultivating in them. All right, because why? When you ask your boys or girls to sit straight, right, what is the hunch or the nature? They will try to push themselves to sit straight. So when they push themselves to sit straight, they are overarching their low back. Okay, all right. So this is a very, very wrong instruction. This is my passion today, to tell all our parents, sit straight, or asking your kids to sit straight is a very wrong instruction. All right, do not ask them to sit straight anymore. All right, but in fact, you just need to tell them to sit tall. Okay, if you want to use another word, we call it sit tall. Sit tall means, right, you feel like something is pulling your hair, something upward. That's all. You are not pushing yourself from the spine, but sit tall means something is pulling your head up. That's all. This is what we call sit tall. All right, but not sit straight. All right. So the photos on the left, which is my colleague. All right. So she is showing something. She is sitting tall. All right. In her mind, also she's sitting tall, whereby she's imagining something is pulling her hair upward. That's all. But she's not pushing herself over straighten her spine like the photo on the right hand side. Okay. So this is what we'll try to say today. Sit straight is not the proper instruction, but sit tall, yes. Okay. So same thing to standing. Stand tall, but don't stand straight. All right. Stand straight only apply for soldiers, policemen. All right. Don't stand straight anymore, but stand tall. Same thing when you're standing tall, try to imagine that something is pulling your head upward. All right. But not overarching your low back. Okay. So these are the few things that I think parents have to change. Otherwise, you are cultivating slowly low back pain in your kids. I guarantee. Okay. So all right. So we have finished up all our courses. Okay, of low back pain, which is we call it overarch low back. All right. So next will be our remedy. Okay, I would want to share a little bit of simple remedy, which until today I'm still doing at home. All right, and I believe everyone should be able to do it at home. Okay, so we have 5 tips today. Okay, we have 1, 2, 3, 4, 5. Okay, we have 5 today. All right, so let's go one by one. Okay, remember what we're trying to do? Low back, number 1. Number 2, hip flexors, which is the front muscles. Okay, another root cause. Number 3, we have to build your core muscles. Number 4, we have to build your buttock muscle. All right, our exercise, our regime today, our remedy today have to cover all these 4 muscles. All right, as I told you, sorry. So as I told you, all right, so if you don't cover all these 4 muscles, your back pain will never get better. All right, and okay, now, so exercise number 1. Okay, we call it knee to chest. All right, we call it knee to chest. That means what? We are lying down on the bed, okay, or you're lying down on the floor with a yoga mat or whatever. Now bring your knees to your chest. Okay, bring your knees to your chest, not one knee, okay, but both knees. Okay, bring your knees to your chest. All right, this is meant to stretch your low back. Okay, Or another way we call it baby pose, child pose, okay, or prayer pose. All right, my Muslim clients, I will call them almost prayer pose. Okay, or sometimes I will make kidding with them. Hey, how many times you pray yesterday? Did you do your stretching? You know what I mean? All right, we call it baby pose, child pose, or prayer pose. All right, it's also meant to stretch your lower back. Okay, now these two exercises we call it stretching. All right, if you want to ask me what is stretching, stretching means I'm trying to stretch my muscles, make it loose. Okay, the stiffer the muscles, the more you're going to have pain. So you make your muscle loose, more flexible, then you have less pain. Okay, so these two stretchings we suggest 10 to 15 seconds every time when you hold. When you try to stretch. All right, hold for 10 to 15 seconds. All right, so if you ask me, hey Ben, in my class, right, and hold for 1 minute, oh fine, okay, at least 10 to 15 seconds. All right, some people say, oh, I bring my knee to the chest every morning, 2 seconds. Very good enough. Okay, 2 seconds not enough for your muscles to change, to make a change. All right, so we need about 10 15 seconds or even longer, okay, for these stretchings. And how many times I need to do? It depends. If you like a figure of 3, then you do 3. If you like the number of 5, you do 5. All right, you do more, no harm. Okay, yeah, it's your own benefits. Okay, so we have muscles, we have exercise number 1 and we have exercise number 2. All right, now this is the third one. Okay, this is the third one. I call it Michael Jackson. All right, so in my center, I always call this exercise as a Michael Jackson. All right, now why I call it Michael Jackson? All right, for my patients, so easy to remember lah. All right, now basically Michael Jackson is what? Is you're playing with your pelvic bone. All right, so now if you all can see the picture on the left hand side, all right, so you initially have an arch low back. So now when you do Michael Jackson, you just need to bring down your low back. All right, so you have your arch low back, and then when you're doing a Michael Jackson, you just need to roll down your low back. All right, you make it more neutral. All right, so in the cartoon or animated one, also same thing. Okay, so on the right anterior pelvic tilt, whereby you have a overarch low back, and then you try to neutralize your pelvis. All right, whereby you do Michael Jackson. All right, so you also can do it in lying down. Okay, while you're on the floor. All right, now the picture on top, you arch your low back, and then you flatten your low back. Okay, you arch your low back, and then you flatten your low back. Now this is what we call Michael Jackson. Okay, so on the left, you're doing Michael Jackson in standing. On the right, you are doing Michael Jackson in lying down. Depends what you like. Okay, so in a more proper way, we call it pelvic tilt. Okay, you tilt your pelvic. Okay, tilt to arch and tilt to flatten. We call it pelvic tilt. All right, so this is the third exercise. Okay, now if you don't know Michael Jackson, just drop us a comment or what, so we may lead you where to can see the exercise. Okay, so okay, now exercise number 4. So as I said just now, we need to stretch our hip muscles. I just go back a little bit. Yeah, we need to stretch our, you see, stiff or tight hip flexors, which is the front muscles. Okay, which is the front muscles here. All right, so now how to stretch the front muscles now? On the picture on the left, all right, we just need to hold our knee, hold our heel, okay, behind, okay, and therefore we will stretch. Now we will feel the pulling in the front of the thigh. Okay, so this is what we call quadricep stretch. Okay, we are stretching the front thigh muscle. All right, so if you're having low back pain, or you may not have low back pain, this is a good exercise for everyone. Okay, this is a very good exercise for everyone. Okay, if you have low back pain, if you have no low back pain, this is still a good exercise for everyone. Okay, now photos on the right hand side, lunges. Okay, so lunges also is try to stretch the front muscles which contribute to the low back. Okay, now same thing, this is a stretching exercise and we will want you to hold it for 10 to 15 seconds. Okay, now there is a trick. All right, now there is a trick. So now if you look at the quad stretch on the left hand side, right, now there is a cross, okay, for the first photo. Why it is crossed? Okay, reason very simple. When he was trying to do this stretching, he overarched his low back, if you all notice it. All right, now this is wrong. All right, so when we want to stretch our thigh muscles, always remember, you still need to maintain your low back, not to overarch. Okay, now same thing to the photo on the right hand side. So actually I purposely put a photo which is not really correct one. The position is correct, but the arch. All right, so now everyone, if you can tell me, or you can ask yourself whether the lady on the right hand side, is she overarching herself Now, my answer is yes. All right, so therefore, when you try to do this lunge, just stretching, now always be aware of your lunge. All right, make sure that your spine, be aware of your spine, okay? Make sure that your spine is in a neutral or not overarch position when you try to do them. Okay, this is my hint. All right, this is my hint. And yep, all right, so we have these 5 simple exercises, all right, which can cover your low back pain. All right, so we covered out muscles 1, 2, 3, and 4. Now, a small little tips for everyone, right? Now, actually, for those who always suffer low back pain, right? Trust me, you also have a high tendency to have knee pain. All right, why? Because the front muscles, okay, on the left hand side, the front muscles that controlling your low back pain is also the muscles that controlling your knee. All right, so this is a small hint that I'm going to warn you. So therefore, it's not a surprise, okay? If you have back pain and you also have knee pain, or your elderly at home have back pain, they also will have some knee pain for sure. All right, because body works in a group, okay, as a chain. They don't work in one piece. Oh, I only work on my low back, my knee is okay. No, okay, they come in connection. All right, so it's just a small hint for everyone. All right, so I think that's all for my five exercises at home, 5 tips to do it at home. All right, and thank you very much. Thank you.
You can stop sharing.
Yes.
Thank you, Mr.
Okay.
Ben, and thank you for those actually staying with us. Now we are actually open for the Q&A sessions. You guys may drop your concern or any questions to us in our video post below. Okay, there's some questions already. So there's one that actually asking, when we sit, is it good to put a pillow behind us?
Okay. So very good question. This is which is a lot of people will ask. Okay, now let's put it this way. Why we need a pillow in the first place? Okay, so that's number 1, question number 1. And number 2 is what is the distance, okay, between your backbone, your low back, and your chair backrest support. So actually the pillows that we put, right, is meant to overcome the space, okay, between your back and the chair. Why we need a pillow? All right, so actually because we want the pillow to replace, okay, or to overcome the gap between our low back and the chair. All right, so normally we advise more than 1 pillow. All right, because the gap between the back and the chair normally will be a little bit more wider than 1 pillow. Okay, so you may need more than 1 pillows, okay, to overcome, and the pillows will serve as a low back support as well. Right, so I mean, in summary, 1 pillow may not be enough. All right, you may have 2 or 3. Yeah, it depends. Yeah, okay, it depends how big the chair is.
Okay, okay. There's also a question that how soon after a woman deliver baby can start to do all the exercise that you shared just now?
All right, so now according to Chinese confinement theory, all right, so it may be about 1 month to 2 months time. All right, now, but according to Western knowledge and our practice, right, it can be as soon as when your wound heal. All right, so if you are what calls a normal delivery, so you wait for your wound at the vagina there to heal. All right, if your wound is a cesarean cut, so you also wait for the wound to heal. All right, because during the healing process, we are trying not to disturb the muscles contraction. All right, so therefore, ideally, it's at least 2 weeks later. Okay, but for Chinese one, they may want to wait until finish confinement, which is 1 month later. I used to have so I had used to have a Western clients, right? After confinements within 10 days, they come and see us already. Yeah, something like this.
It's about culture things also,
yes,
right?
yes.
Okay.
Yeah, but literally it's about 10 to 14 days to let the healing to take place first of the wound, and then the rest you can do.
Understand. And also this exercise is suitable for elderly as well.
Oh yes, definitely. Now, but again, now a lot of people say, oh, no pain, no gain. Wow, the more I do, the more I pain, and the more I do again. So actually it's wrong. A good and proper exercise should be, you feel more comfortable after you do. Okay? If you don't feel comfortable after you do, then you better don't do. The exercise is not beneficial to you. All right. So even though to elderly also same thing. All right. Now if you do and you can do, go ahead. Don't force. All right. For example, like the child pose that I put just now. Now some elderly also come with some knee pain. All right. Child pose, you may not able to fold your knee fully, entirely. So that will be the restriction for elderly. Other than that, most they may able to do it.
Okay, so which means that actually you feel the pain at the knee because of you doing child pose, you shouldn't proceed anymore, right?
Yes. Because you may have underlying knee problem.
Oh,
Yes. Okay, a lot of people have underlying problems, but they only identify the most severe pain first. Because
okay.
brain interpret the higher stimulus of pain first. They don't interpret all pain.
Okay.
Uh,
All right. Okay, then another questions from the floor is that any reason after a person wake up, he feel his lower back pain?
mm.
Any way to avoid or improve this?
Okay, now so this one go back to our topic today. So there are two types of low back. So what I want to ask him is which type of pain he has. He totally can't get up, or he still can get up with pain. Now, if he totally can't get up, that means he's having multi-cramp. All right. So if he still can get up, but it's just in pain, most likely he's having sacral swelling. Okay. So it depends which category he falls in. Now, multi-cramp, that means both definitely you still need a physio anyway. All right. It's just that if multi-cramp, you need a physio as soon as possible because if there's a cramp, you need to get rid of the cramp as soon as possible. Now, if sacral swelling, you can delay 1 or 2 days. All right. Now, both for the immediate treatment will be ice pack for now. Okay, get a very cold ice pack, put at the back first. Numb the pain, bring down the inflammation. Because by using ice pack, you're tackling both potential problems. Then next is fix the appointment already. Yes.
Okay.
Yeah.
Okay, and then is lower back pain cause migraine or migraine cause lower back pain?
Oh,
Quite a good
okay.
question.
That's a good question. Okay, now if everyone noticed, right, the photo that I showed just now, there are 3 real photos. One, there was a young lady on the left, there was a middle-aged lady, and there was a guy. Now,
Yep.
these are our clients. Now, this young lady, she's about, if I'm not mistaken, she's about early 20s. Actually, she came from migraine, and she has been suffering migraine since age of 15 or 16. All right, and very worst is every time when she has periodical migraine, we call it. All right, now, how I treated her, actually, I treated her low back pain. All right. Oh, sorry, I treated her from her low back. She doesn't complain of low back pain, but I treated her from her low back because of her overarch. So actually, basically, right, if everyone knows, right, migraine, where the skull is, all right, the muscles that attach to the skull, it comes all the way from your tailbone. All right, so therefore, I would not say migraine caused by low back, but yeah, it's the same muscle. We are talking about the same muscle. All right, the muscle that attach to the skull actually it originate also from your low back tailbone. So if I want to treat a migraine, yes, I will look into your tailbone as well, low back and tailbone. Yeah, so I hope this one will answer her question. Because not
Okay.
many people will treat migraine from low back. Not many people. Not
Okay.
many. Normally they'll treat from the neck and shoulder.
Okay.
Mm,
Okay. Another case is actually experienced by my friends is that I give you a scenario. They would like to get your advice lah. Actually,
mm,
he's getting hurt from badminton.
mm,
Okay, he recovered via cupping therapy, but it comes
mm,
back. So
mm.
which means actually the problem is not solved, right?
Yes, not
So
solved.
actually,
Yes.
what should he do
Okay, now,
for the next?
okay, so when we say low back pain, right? So it covers a lot of muscles around the low back. It can be the right side, it can be the left side, it can be the central. So now today our low back pain, we only covered the central and general posture. Now, because you were saying your friend is a badminton player and he or she got it during the badminton.
Yep.
All right, now,
Yep.
okay, I assume that he's a right-handed badminton player. So now, if he's a right-handed badminton player, right, our typical movements, okay, during the badminton is all on the right back, right?
Yep. Correct.
So therefore, he or she, her pain should be on her right back more. Okay, so now this one is a one-sided muscle. All right, now the exercises that we gave just now, not covering this muscle actually. All right, it's a side muscle. It's not really the central muscle. Yeah. So therefore, yes, the muscle we call it quadratus lumborum. So it's the side muscles of the low back. Yeah. So therefore, yes, she is correct halfway, whereby cupping does release her pain. All right, but cupping does not find out yet where is her root cause. So actually her root cause most likely is associated with her left pelvic or the left hip, the right back and the left hip. The root cause comes from the left leg. Yes, this is why we call it games placement, because your foot placement and your games is all related. Yeah.
So
So her
actually,
root cause,
mm,
yes.
yeah. So actually, the next thing actually he needs to do is it's not like stop playing. He has to actually still
Oh yes.
consult a physio.
Yes, you definitely still need to consult a physio, find out the root cause, okay? But not, as I said, not only treating the back, you must find out the root cause. Then only you know, okay, fit enough to go back again. Yes, okay, as a physio, our job is not to stop our clients. Hey, Shireen, you got pain here, you cannot play this anymore. Hey, you got high heel pain and you cannot play wear anymore. No, our job is to help you to go back. This is what I call physio. Okay, my job is help you to go back to your work, to your whatever you want.
Okay.
Yeah.
So as also low back is not a serious life-threatening medical condition. Is it true? Because some
Okay lah.
people may can sustain this pain quite some time.
Yes. Okay. So let's put it. Okay. Let me share with you, right? Okay. So today I do not share very deep enough, right? So now low back pain from our point of view, very simple, muscle. All right, muscles, soft tissues. But if you go into MRI already, all right, it will tell you a little bit different story. All right, it can tell you a little bit more deeper, slip disc. Okay, there's a bone spurs and compression. Now let's put it this way. Okay, if you are a patient and you are warned and or you are overwhelmed with the information of slip disc, slip disc, slip disc. So at the end of the day, right, your mindset will change in a way. Oh, I have slip disc, I cannot do this. I have slip disc, I cannot carry my baby. I have slip disc, I cannot bend forward and brush my teeth. Because this is our real case, our patients. She has been diagnosed with slip disc since 7 years ago. And the moment she came and see me, she told me, hey Ben, I got slip disc 7 years ago, MRI done 2 times, confirmed. And my doctor tells me I cannot do this, I cannot do this. I can't even carry my kids. I say, no, this is not the way. All right. So it's not life-threatening to your back, but it's life-threatening to the whole life. It changed your whole life. All right. So therefore, when you come to physio, is that you must get something to answer and answerable to your question, to your pain. This is more important. Find the answer that answerable to your pain. This is what I always try my best to tell my patient. Okay. So my patient golf swing, got pain. I will tell you, look, let me see how is your golf swing. Because I want to find out what swings, what type of swings or what problem cause your back pain. But not telling, oh, you got slip disc, sorry. Okay, that no. Okay, you understand what I mean? Yeah. It's
Okay,
not life-threatening, but it's just that you will bear in your mind forever.
okay.
Yes.
Okay, so another thing is also, I mean, just like one of the scenario you say about the parents tell the kids need to sit straight,
Yes.
sit straight. Okay,
Yes.
this another things that we also say that don't lift heavy things. Lift heavy things. This session cause you back pain.
Yes.
So, what's any comments on this?
Okay. Now, okay. If you ask me, lift heavy things, how heavy is heavy? Okay, now according to NIOSH, NIOSH is a national some occupational health, okay, so the organization, 15 kilogram and above, we call it heavy. Okay, so that means what, if you are carrying some objects, okay, more than 15, okay, this 15 kilogram, I may be wrong. So according to these rules, right, if something is beyond this 15 kilogram, but this 15 is yet to finalize, that means it's heavy enough and you require 2 people to carry. Yeah. So when we say don't carry heavy things, how heavy is the definition. Okay. So that's one thing. Now number 2 is, yes, if you want to carry heavy things, all right, always squat down, okay, and carry up with your legs. Okay, instead of using your backbone to carry the things up. Yeah. Okay. So this is the warning, the warm warning that we can give to everyone. All right, always squat down. That's why I say 100 ringgit banknotes. Even if it's one bag of 100 ringgit of banknotes, same thing. Squat down, hold it, hold tight to your chest, then only carry up. Just don't just carry like this. Yes, yes. Okay, unless you are a golfer. Okay, so now if you know golfer, right, how they pick up the golf ball. So there's a special technique, man. They will pivot at their hip. Yeah, they will pivot at their hip, and then one leg will be backward up. Golfer. Okay, so now, yeah, unless you know that way, okay, otherwise you follow the normal way. Squat down first, carry the things to you, and then stand up. Yes.
Okay. The main purpose is just to not to stress out the lower back, not to
Yes.
give the pressure to the lower back.
Yes. Because
Okay,
low back is very, very fragile.
okay, man. Another question from me is that more pulse, more pain. Skinny people actually means pain-free. Is it true?
Oh no, totally not. As long as you're human, you definitely will have pain.
Doesn't mean
Okay.
that obese people or very fat guys actually they will have higher chance to get lower back pain.
No, not necessary. Not necessary. Now, thin people, fat people, young people, old people, everyone have the chance to got back pain. So that's why for physio, right, our patients age range, it can be as young as 12 and as old as 90. Okay. So regardless of your age, regardless of your gender, regardless of your body weights. All right. And how to explain all this? Muscles, biomechanic. Okay, when your biomechanic wrongs, everything comes in, your pain comes in. Okay, so don't feel happy if you're thin, but don't feel sad if you're fat. Yeah, okay, yes.
All
Yeah,
right. Okay, let's get the last questions from the
sure.
floor. Okay, does strong core prevent back pain?
Okay, okay. If you okay, so I guess this is I think he or she does some gym workout as well, so that's why he
Yeah.
asked this question. Okay, so let's put it this way: two questions inside this question. Now, number one, how do you know, or how familiar you are with what is core? Do you know what is core muscles? All right, number one. And number two, the answer for this question is no. You can have very strong core muscles, but it does not promise that your back pain won't come in. Okay, now core muscles actually, okay, for gym people, right, core muscles, they always say this is my six packs. I got six packs, I got core muscles. So actually it's wrong. Core muscle does not include six packs. Okay, six pack is only the superficial muscle, and then we have our obliques muscles, tummy muscles. Our core muscle is the deepest muscles inside.
Inner one.
Inner one, yes, we call it
Okay.
transverse abdominis. So it's the deepest muscle, and this core muscle is not visibly seen as a six pack one. All right, so therefore, you have six pack does not mean that you have strong core muscles. Okay, so that I hope I answered the question. And now number two, yes, you can have, okay, maybe you are engaging a very good core muscles now, the deep one. But it also does not mean that your low back pain won't come, because why? Core muscle is a muscle that you need to ask them to come into work. Okay. Yeah, it's not that, oh, I built my muscles very strong now, my core muscle anytime is ready. No. Core muscle is you need to call them to come into work when you need them.
Okay.
Okay. For example, I want to carry something from the floor. All right. I know my core is good, but I still need to intentionally engage my core a little bit to lift up. Baby also same thing. Yes.
Okay. But
Yeah.
how to
Okay.
call? It seems like very subjective.
Yes. How to call Michael Jackson? Just now my Michael Jackson movement,
Tune.
pelvic tilt. Yes. So the pelvic tilt actually is a calling of your transverse abdominis or of your deep core muscles. Okay. So when I say call your core muscles, that means you do a pelvic tilt a little bit, engage already, and then you lift up. Okay. So that's
Okay.
why actually if you notice, right, a lot of gym people, they carry weights one, heavy weights one. They always come with a belt, very tight belts around their waist. No matter how strong their core is, okay, when they want to lift up this kind of heavy lift, right, 100 kilo, 125 kilos, they need the additional belt because your core will never sufficient for you. Okay.
Yeah.
Yep.
All right. Okay. Okay,
Okay.
thanks again, Mr.
Hey,
Ben,
welcome. Thank you.
for
Thank you.
tonight
Thank you. Thank you.
sharing, and
Yep.
thanks for the friends that actually stay with us. If you like tonight sharings regarding low back pain, just share around these videos. And
Yep.
if you have any questions in our post, we actually have a way to contact Mr. Ben. You can click in that way and you can reach Mr. Ben for this.
Yep.
Before
Right.
I end, I would like to inform that next Wednesday is Malaysia Day. We will have a break. The week after next week, we will have a gynecologist to talk about infertility in men in Mandarin. And for more information, please check out our announcement post. I'm here on behalf of Erufu Care. Would like to wish all Malaysians Hari Malaysia. Good night, Mr. Ben, and good night,
All right.
everyone.
Thank you. Thank you.
Good
Thank you.
night.
All right.